Hi to all of you who watch these videos in regards to total knee replacements, whether you're contemplating having one done or if you're going through one currently. This is my little episode about my 6-week venture into the hospital to see the consultant, and currently what I can and can't do. Such things like what's the pain level like, what medications am I taking, so let's get into it.
Get on my knees for no man.
Get on your knees, honey.
So here I am, 6 weeks after the operation. I'm back at the hospital. I've just had x-rays done on the right knee, and we're off to see the surgeon at the orthopedic clinic to see if it's going to be a sign-off, or if not, I'm not sure what's going to happen, but hopefully I think it's going to be a sign-off today, 6 weeks later, post-op. So we have our form, which is for the outpatients clinic, that goes into the pink tray, the infamous pink tray that we'll find up here, and we just sit and wait. All very quiet in here today. Well, we didn't actually get the sign-off. I've got to go back in 6 months. That's all over. I saw a young consultant, I can't remember her name, and even though my surgeon was actually in there, I thought I'd probably go and see him. But not so much a sign-off as such, but they're very impressed with how much I can bend. Still got to work on straightening the leg, but so far they say I'm going extremely well, better than a lot of patients that they've had, particularly of my age, which is heading towards 70, and so not so much a sign-off, but I will have to go back because I've had both knees done. It will require me to go back in another 6 months for a checkup on the right knee, and they can also have a quick look at the left knee as well, and then another 6 months after that for the final, which will hopefully I think be the final sign-off. They suggested if I have any other issues to come back or notify them, but I don't think there will be. So it's progressing along quite well according to them. I pointed out all the bits of pain that I get, and I think the only, which was non-medical advice I got, was to moisturise the scar, which I actually did on the first one, but not so much on this one. So it did look actually a little bit dry. It still does have a little bit of scabbing on it, but by and large, yeah, I've got to come back in another 6 months, see what happens then. Okay, so whilst I walk back from being in the garden, I've got a number of steps throughout, which, as you would know, it's down into hell, so that's with the knee that's just been replaced, and up into heaven with your good leg. So when you're going up, you start with your good leg. When you're going down, you start with your bad leg. I'm still doing that, although there are moments when I try to do it on the smaller steps. It's not quite so bad. So that's my replaced knee going down first. Doesn't really affect me too much on the shorter steps. The little higher ones probably a little bit more difficult. So that's one thing I'm still encountering, is not being able to walk up and down steps 100%. Probably 80% of the time I can do it, but we're still working on it. Well, so far I've been off pain medications for a number of weeks. I pretty much only continued through with the doses that I received from the hospital on discharge. There has been occasions when I've wanted to take medication to get to sleep. That is still a little issue. It's getting better, but it had been uncomfortable trying to get to sleep, as you all know and become aware of if you're going through this experience. Lying on your back is pretty much it, although I can get comfortable on my side without too much issue at the moment. It's just a matter of trying to find which leg goes where. I can start off in a like so, with knees together for some time, then it starts to ache. The first few minutes are pretty much good, and you think, wow, here we go, comfortable sleep. But after a while it starts to ache and you have to throw your leg around, and so those issues are still ongoing. I think they're going to improve, and I'm trying to recollect from when I had my first knee, the left knee, done, as to how long it took, and I think it was pretty much probably about the same amount of time, but it didn't hurt as much. This is another thing that I've got with this right knee after coming out of surgery, and now still up to the 6-week point. I'm still experiencing not so much pain but aching. It just has like a headachy, toothache type pain. Comes and goes. If I'm busy or if I'm in a comfortable position, don't experience it. As soon as I get into bed, after a few minutes or so, then it starts to fire up. It's a weird thing that when you try to go to sleep, that it's just going to be there. I have been guilty of taking the odd nap during the day, which is not supposed to be recommended by some experts, that it does upset your sleep pattern at night, and you tend to wake up a little bit too early and you experience the pain and you can't get back to sleep. But those things, it's up to yourself. If you want to have a nap, if you feel the need to have a nap, I would suggest just have a nap and worry about it later. But I don't tend to have too many naps, but I'm in a recliner from most of the evening watching TV, stretching the quads, and whilst I'm in the recliner, and try to get a normal 7-8 hours sleep during the night. Now, as far as the knee physically looks, it's still swollen, and I'll give you a look. That's the knee there compared to the one that was done. This one was done 6 months ago. This one is currently, as you can see, it looks quite fat, or the swelling looks sort of quite fattish, whereas this one never was. It was always spongy and just had a lot of loose sponginess about it. That's the difference between this one and that one so far. As far as the scarring goes, it's on its way. That one is sort of pretty good. So there's still a few wrinkly bits where there's still a little bit of swelling under that one, but by and large it's not too bad. No concern from the consultant yesterday. As far as physio goes, they're very impressed with me. His words are amazed, and I'm pretty sure that's what he said about when I was doing physio on the first knee replacement, which was the left one. I can't actually get the right one 100% flat. We're about 3 degrees off, so I'm doing a little bit of work trying to stretch it out and push down on it with the quad. I do that quite often. There's a number of places you can just sitting. I'm doing it now, actually, just pushing my foot out and trying to force down the back of the knee. I'm still getting a fair amount of tightness in the top of the calf and the bottom of the hamstring. Similar to when I had the left knee done, that was quite painful at the top of the calf for quite some time. But this one is a little bit different. It only pains me when I actually put some work into it. If I was to do a squat, then I would feel it. But other than that, it's not bad. It's sort of a different feeling to the left one. So no two knees are the same, really, and I suppose no two people are the same. Slight differences between everybody, I guess, but by and large, the whole operation is going to be the same for most people. As far as the physio goes, yes, I can bend it to. I was up to on Monday. It's now 3 days later, 125 degrees on the bend, and that is pretty good for 6 weeks out. So let me just see if I can show you. Okay, so that's comfortably bending. So on that one, you're getting the knee out straight. You can see there's still a little bit of a curve underneath it. Walking around unaided, no canes, walking sticks, walking frames, crutches, gave those up a number of weeks ago. Just found it easier that manoeuvring around was a little bit easier without any encumbrances of the crutches and so forth. So balance is not bad. I have the tendency every now and again for the leg to feel like it's giving way, but it doesn't. It just feels like it is, but it doesn't. You sort of can grab it back. Same with the left one. I'm still getting that experience as well, but I haven't fallen over yet, so that's a good thing. I have climbed up a couple of ladders. I've mowed lawns. I've been reasonably active on it, even though they say that you should still be taking it easy. I find that if you keep it moving, it tends to feel a lot better. What I did find also with the left knee, since the right knee had been done and I was incapacitated to some degree, that one started to feel like it was really stiffening up, and that is just something that is common. It is a mechanical implant that you have, and it does require movement. So there's no fear about wearing the thing out prematurely. You need to just keep the thing moving, and it does feel better. Like walking, once you've done a little bit of walking, it feels a lot better, actually. In my case it does, so I'm not sure about everybody, but that's what I'm finding. As most of you probably have been doing, is doing your research. YouTube has quite a lot on there about total knee replacements and knee operations, and what I have seen is that some of the women tend to experience pain a lot more than the guys do, and I'm not sure if this is just because of their tolerance. It does hurt, but it just worries me a little bit that they might be putting people off having this operation done by saying it is really excruciatingly painful, would never consider doing it again, and things like that, whereas the majority of people on there do actually say it's a good thing, and after 12 months rehab you're pretty much right as rain and as you were before, or actually even better than before, because most of you would have had osteoarthritic knees and experiencing pain bending and sitting down and standing up, which is what I did. So I can feel the difference there. There is no pain from that or associated with arthritis. The only pain is with muscle tightness and stiffness. Now let me show you, just after it's just been 6 months since I had the first one done, my left knee, and I'll just show you the bend that I have now, and it's got absolutely no pain with it. So that's pretty good as far as I'm concerned. And as I said, there's no pain associated with that. Flexing it out into a straight position doesn't really hurt. So after 6 months, I'm pretty happy with that one. It just does, as I said earlier, it just tends to get stiff if I don't use it. But when I'm actually using it, the stiffness does decrease somewhat, and you don't really notice it other than going down steps. But that's not one of the things that you really should be wanting to do at this point. So, but it's not impossible. I can do it. I'm having a crack at it anyway. But really, that's about it. It's progressing quite nicely.